My name is David Triebes and I'm the CEO of Samaritan Albany General Hospital. I have pretty significant arthritis in the knee and it's bone on bone, so it's kind of like this, and my meniscus cartilage is gone, and so I'm now to a point where that constant rubbing and pressure is really creating a problem.
Walking is a daily thing in the house. We got a little pup that we need to walk, and I love when Dave comes with me, but often he won't come with me because we're in the hills. Of course, I love to see him come to yoga. It always just makes my day when he comes to my class.
Some of the postures that I was able to get through early on are just very difficult for me now. I haven't let it go to a point where I have pain every moment of every day, but I have much more significant amounts of pain now than I did 4 to 5 years ago.
It is hard to watch the pain that he has.
The joint replacement program has changed people's lives and made them able to do things that they never thought they were going to be able to do again and really enjoy their lives again. It's one of those feel-good programs that just make you feel good to be able to help somebody get to where they want to go.
I've been with Samaritan Health now for over 12 years. I see the outcome, I see the results, I see how patients end up when they come through our program, and it's been very easy for me to make a decision to come here.
It's a big process to decide to have a joint replacement, and we make sure they understand everything involved in the process of having a joint replacement, from going into the clinic to see their surgeon to have their preoperative work done, to knowing exactly what to expect through surgery during their hospitalization and then after hospital when they go home and recover and what that entails. The patient themselves have to commit to it, and so we like to make sure that they're very aware ahead of time, and it tends to give them excellent results. The 5-Star Award puts us in the top 10% in the nation for joint replacement programs, which is exciting and encouraging for people who live in a small community to be able to get that level of care in our area and know that their outcomes would be just as good or better than if they went to some of the bigger cities and had their surgery done there.
We are a center of excellence for our total joint program. When hospitals are able to develop that, then it's not uncommon for them to segregate out that population of patients and be able to even improve on the care delivery for that group. And certainly now that we've dedicated this floor to these kinds of cases, I feel it's a privilege to be able to be one of the first patients on the floor.
I'm really excited to see David go through this process. I think it's going to make a big difference in his life. I think he's going to have a lot more comfort in his daily activities that he does and be able to get out there and enjoy life a lot more again.
It will help the whole family. As he feels good, we move more, we do more.
He sounds like he might be okay.
Hey.
Starting day 1 post-op, we have our patients hopefully up and out of bed, doing their exercises, walking down the hallway. The faster we get people moving, then the faster the healing starts. So we want him and our other patients to actually be using that knee as functionally as possible, because that will just speed up their rehab. Dave is making really great gains because he's already got what we call quad control, which means that he can straighten his knee out and hold his weight on his leg. So he actually walked down the hall and back, starting with a real easy gait pattern and then progressing more normally to being able to step 1 foot in front of the other.
Yeah, now the swelling you have is you may have a little more than normal, but it's normal to have swelling.
Right now when I touch your leg,
No,
it's
good.
not a big deal.
Yeah.
But if there's a problem, just a light touch is going to make that uncomfortable, or pulling his calf up is the other real telltale sign. So remember, whenever you go from sitting, or laying down to sitting to standing, you always want to take a few seconds just to kind of...
When am I? About 49 hours post-op. So So I think I'm doing great. Should be able to go home this afternoon, as long as I can still do the stairs like Karen had me do earlier.
You walked in extremely well.
Thanks.
Better than you were walking when I saw you before the surgery.
Is that right?
Yeah.
Well, I've been working with a physical therapist at home for the last several weeks and had my staples taken out. I've ditched the crutches, I've ditched the walker, I've ditched the cane. So I think I'm making pretty decent progress right now. The most pain I get is if I stand in one spot and don't move. It'll be stiff and I'll have to sort of stretch it out for a little bit.
Things have been going great. I've been out on the golf course at least a half a dozen times. I think when I first started out, you could tell that something was a little different than it was. It wasn't painful, it just was a little different. The last couple tournaments felt really good, and in terms of the rotation that I'd get and the comfort level with the knee. So it feels really good. You always hear how good it is from other patients, the 5-star ranking. I mean, that's fabulous, but to go through it myself, now I understand how good it really is.